So this is being recorded so that I can post it on the South Carolina page so folks can view it later if they're unable to attend the live webinar. What I'm going to do also is bring up our South Carolina page here, just so folks are familiar with this. When you're on Therap's homepage, you would go to States, and if you just click on that, the hover will expand, and you can click on South Carolina. So we are adding information on a regular basis to this. This table, of course, is the implementation plan and guidance information table. So it's really going to list out the modules which are required as part of the implementation under DDSN, and the dates that those modules are expected to be used live. So ISP programs and ISP data are expected to be used as of 9/1. What that means is that this is the time to be writing your ISP programs for goals and objectives and make sure that you have them approved for the 1st of September so that your staff can in turn collect data on the 1st of September. So that is the expectation. We've worked with a lot of providers already on ISP programs, so I think some of you are here as a refresher or to get your questions answered, which is totally fine. Also keep in mind that as of September 1st, health tracking is expected to be used live. There are not guidances as far as which aspects of health tracking you're expected to use. Really what you should be doing is replacing what is done on paper and putting that into Therap. So if for some individuals you're tracking seizures, height and weight, menses, if you're keeping track of their doctor's appointments, all of that can be done in Therap under the health tracking section. And that's something that people have been trained on already in the first round of training, but we certainly can add on and include that for training. So down under the events section, that's where we have our online trainings available, and the registration links are there. Sorry about that, hover there. Then the recorded webinars are posted down below. So we've only been posting those ones that really stand out, that there was some strong questions and interaction between the attendees. That seems to be the most beneficial for folks to listen in on. Okay, so getting back to the dashboard. For those of you that are admin staff, just keep in mind that in order for your staff to have access to writing ISP programs or collecting ISP data, you will need to, of course, assign them the necessary super roles. I'm in a demo account, so my list of super roles is ridiculously long. If you had a super role titled by CTH2 coordinator, for example, I don't have one in this account. I do in the South Carolina account. So it may be in this account, something similar might be manager. So just using this as an example, whomever is responsible for writing goals and objectives at your specific agency or board, you would make sure that under their super role list, they have the ISP program roles checked off. So we'll start there. So if the person is responsible, or the people, because this is by job title typically, are responsible for writing ISP programs for goals and objectives, you would assign them submit. If they're also responsible for approving, you would check that off. And update allows that group to make changes to ISP programs even after they've been approved. Typically speaking, this role is assigned to someone in a more senior position. It may be that someone that supervises the CTH2 coordinators, for example, would be assigned that. You're really going to need to make those decisions internally. We're not going to tell you exactly what each person should have, but as a rule of thumb, those people that are writing the ISP programs absolutely need to submit. If you want them to approve their own, then you would assign that, and they would absolutely need view. And then you determine who should have update and delete. For ISP data, this same group of staff should be able to submit data You may consider allowing the CTH2 coordinators, if they're the writers of the ISP programs, to also have ISP data update and ISP report. Just keep in mind, anytime you see update in any of the super roles, what that means is that they can change the integrity of what was written, including in the ISP data in this box. So that will allow them to do that. There will always be a trace within the system of changes that were made, along with the electronic signature and date and timestamp of the person that made the change. So this is just a basic review of what you would want for these modules. When you get into the staff that are actually collecting the data, the ISP data, then you would need to look at their super role. And for those staff, you need to make sure that they have ISP data checked off. You would only allow them to have access to ISP reports if it's part of their job responsibility to go in and run those monthly reports. The monthly reports can be used for monthly summary notes and progress notes. So you really want to consider who is currently doing those on paper and replicate that set of responsibilities within the super roles. So I use CTH2 coordinators as an example, but really that, those titles might differ at your specific agency or board. You're thinking about who is responsible for writing goals and objectives, and also the other set of people that are responsible for collecting data. Does anyone have any questions about that set of access rights within super roles? And keep in mind, if they are not assigned, then those staff will not be able to see those specific modules. Any changes that are made should be saved. And I'm just canceling out because I'm in a demo account. Okay, so moving back to the individual tab, this is where the ISP programs are written. There are a lot of options for ISP programs as to how you can set them up. I've met with a number of administrative staff from different boards and private providers over the course of the last few months. I know that Ebony has also met with quite a few providers. Shay and Johanna have also assisted with that, and Jeff Covington. So there's been a good amount of training provided so far around ISP programs. So you may be aware that you can write singular ISP programs one at a time for each individual that are completely person-centered. You also have the ability to write templates that are in turn connected to the individuals. So if you have a great number of individuals working on a very similar or the same set of goals and objectives, such as money management, communication skills, community activities, things like that are pretty common, you may consider writing a template. The difference between the templates and the programs that are individual specific are, of course, that the templates, you wouldn't have any PHI in them. You wouldn't put someone's name in it when you're creating it because you're thinking more globally. You're thinking about the practical use across your programs and connecting that to multiple individuals. When you connect to individuals, you're then able to make it person-centered. What I had planned for today is creating one new ISP program that's really person-centered from the start. Does anyone, I'd like to get a show of hands or have people just chime in. What would people like to see? Would you like to see how to write an ISP program that's individual specific? Or would the group like to see how to write a template? We won't have time to cover both. So I'd like to get your feedback on that. Okay, Donna indicated individual. Thank you, Donna. Anyone else? Okay, Shelley, thank you. Individual. Stacy, great. Okay, so far I've heard from 3 people and the vote is individual. So just keep in mind that if you want to use templates, you certainly can do so. If you need to find some material on help and support, you can just go to the bottom of our page in Therap when you're logged in, or from the home page, go to Help and Support and search for ISP program templates, and that will show you the difference. What we'll cover today is individual-based ISP program. So I'm just jumping right back up. So from the individual tab, I would go to ISP program new. Now what I'm going to ask you, just because I've done this a lot and I've used a lot of different scenarios, what I'd like to hear from people is a suggestion for a goal and objective that you're using at your locations. I have some in mind that I can fall back on, but they're really not that creative. Does anyone have anything that they're using for a goal that we could use as an example today? Okay, well, when you're writing individual specific ISP programs, the first thing you're doing is you're going to the program where the individual receives services. So typically speaking, that's either day or residential, because that's where most of the services are provided. Okay, and I'll go in and I will choose the program. Okay, and then I'll choose the individual. Now, Donna gave me an example of shampooing hair, which I'm going to go with because I haven't used that one yet, to my knowledge. I may have with a different person, but that's going to be good. It's going to be straightforward. It's going to be simple, and I think that'll be a good example for us to use. Thank you for the other examples that people offered up, but Donna did get her suggestion in first, so I'm going to go with it. So I'm going to go with Sarah Active. She's my go-to person in this demo account. She does have a lot of ISP programs in this account, but she's my reliable standby. So your program name really is the goal. What is this person working on? And what we definitely recommend you do is you take what you have, whether it's on Word doc or PDF or on your computer, and take that goal and utilize your terminology. The layout and the formatting and the method of collecting information is what's changing here in Therap, but your terminology, your timeframes, your timelines, the way that you measure the outcome, all of that should stay the same. So if you have it on electronic template, whether it's a Word doc electronically, that would probably be the more common format. That can be great because then you can copy and paste. That certainly would make things easier for you. So if it's something like this, that's this specific, it could be more general. Maybe it's personal hygiene. Maybe it is something that is more related to activities of daily living. You're just going to reflect what is in place for the individual. So I'm going to go with shampooing hair and just keep it simple. The program creation date. Now, today is the 17th, but if I needed to, I could say that this program went into effect months or even years ago. So you're really going to want to use the historic information. If you're starting out with new goals, then certainly reflect that date that it started. But again, if you have a goal that's already in place and you're honoring that timeline of going live with ISP data collection for September 1st, because that's required of you, you can still indicate that this goal was in place at a previous date. If I were to just leave that alone, it will default to today's date. And what that means is I cannot enter any entries prior to today's date. So at any point, if you decide to forward date, such as 9/1, the staff cannot collect data on that goal until 9/1. Just keep that in mind. So the long-term objective, it may be for Sarah to maintain personal hygiene or something like that. It's kind of like the big picture. Okay. And then the goal or service, that might really be broken down as to how we are supporting her on this. You also could put a summary of the action steps here. I think that sometimes people get caught up with the action steps in this box, but really the part that the staff are reporting on doesn't come until later. So this is the structure of the goal, kind of the why is it in place, the rationale for it being in place, and the way that it's being measured as far as completion. So that's what this upper part of the ISP program is all about. Okay. And again, I'm just using my own terminology here. That doesn't mean that you should change your terminology to reflect mine. You should utilize what you have in place already and the standards that you've come to adhere to. Okay. The reason for the program, so that's a little bit more specific to the individual. And then the schedule and frequency is when the staff are expected to work with the individual or when the individual is expected to engage in those action steps or the objectives. And you can mirror the frequency of documentation in line with the schedule and frequency of when that's applied to the individual. You also can indicate the days of the week. So if that's something that's being included on your goals and objectives now, then certainly reflect that here. And I know that might not be realistic, but I'm just using this as an example. For the maximum number of times per day. So this is really if you need to limit the amount of times the staff are able to document on the ISP program itself. I like to take into consideration a few factors, including if the individual is prone to refusing from one staff or refusing and then the staff attempt again on a different shift. And also the documentation expectant. So do we expect the staff to document if the individual refuses? Do we expect the staff to document the attempts that are provided to the individual? All of that will need to be factored before you decide the maximum number of times a day. It's not going to prompt the staff to document this amount of times. It's just going to leave the window open. So I have a tendency when I'm providing these demos to leave the window open and say that the staff can document up to 10 times a day. It's just going to allow for that much. If you only want to see one time a day, that's all you need, and you don't want to risk the staff having double documentation, then you certainly can limit that. Just be aware that it will not allow more than one staff to document within a single date. The location is not a required field, but if this service is to be delivered in the person's home or at a CTH1, then you can, or CTH2. CTH1s are using Therap now, so that could be a possibility. Then certainly you can indicate that. If the service is being delivered in multiple different locations, you might list those out. It's not a required field, so it's really based on your judgment. Now, the target completion date, I indicated that this goal was in effect since June 1st. If the target completion date of this individual needing supports around shampooing her hair is 6 months, I could indicate that, or I could go with a yearly goal date. or if you're looking at every 3 months, that's fine. This will not prevent the staff from documenting as of this date, but really what it's going to be useful for, this field will be displayed in some of the detailed reports. So if you use some of the ISP program or ISP data reports from the report library, or even if you're looking at your ISP programs and just manually monitoring for the target completion date, you'll be able to see that field. But again, it's not going to say that the ISP program expires on that date. Okay, so I could maybe go with a year for my example. The criteria for completion. So this is really how you're measuring the outcome. You're measuring if it's been completed. So for Sarah washing her hair, maybe what we're looking at is overall an increase of independence in activities of daily living, or increase in engagement in personal hygiene tasks, something like that. So if that's going to factor in, then I might get down to Sarah being able to wash her hair with one verbal prompt from staff for every other day of the week for 3 consecutive months or something like that. That might be where that verbiage goes. Some of you use the terminology like 85% of the time, or something like that. So you certainly can indicate it there. Now, materials required, again, this is also an optional field, but this may be where you put any tangible materials that are utilized in order for Sarah to engage in this goal. Okay. Now, the scoring details. Please keep in mind that you can either create scoring methods for each ISP program, or if you have admin rights, you can set up scoring methods that can be used across your programs, and it will populate on the ISP program scoring method page. That can be done from the admin tab, and I will get back to that. This is one of the things that I tend to forget to show you first. I tend to go back to it and show you how you can create them across programs. It's really a matter of how consistent do you want all of your ISP programs. So for example, if you're using pluses and minuses across residential, then you may set that up on the admin tab and it will be displayed in every single ISP program. There are defaults within Therap. So I'm going to go right down and show you what I'm talking about. I'm in a demo account where a lot of people have access to, but the defaults in Therap, I believe, are these 5, because the rest of these are all created within the demo account. So what you will see by default in your Therap accounts are these 5. And you can go to the admin tab and create more that will populate on your lists. Okay, and I will show you that in a few minutes. Alternatively, you can create a brand new one. You can just imagine how many people have access to this. So you can define a new scoring method. So the scoring method is going to be a drop down that the staff get to choose. So again, a lot of people in South Carolina are just replicating the plus and the minus. You also can include things like not applicable, or refused, or did not engage, or absent. So if you want to include any of those options, you'll just make sure that you choose the appropriate level of slots to reflect your options. You can always choose extra and then decrease if you want to get rid of some of those slots. So I'm going to go with labeling this plus, minus, and okay. The label acronym could be just the plus and the minus. It is good to have the acronym because it will show up on your reports. Okay. You don't have to get wordy like I always do. You could just go with a plus. It's really up to you. And some people do use absent. I haven't seen it a lot in residential programs, but it's nice to include. Now, non-reportable. There's been a lot of discussion the last few months from providers using ISP programs about non-reportable. And I hope to clarify things. When you're using ISP programs, you're able to calculate, the system will calculate how often the individual engages based on what the staff have indicated on the ISP data page for each task. So the system will calculate all of your pluses and all your minuses. If you have not applicable and refused and absent, it will also calculate those. So it will be part of the total. So if you're looking for 85% of the time the person engaged in the task, these non-applicable, refused, and absent may take away from that. In my mind, I kind of have a hard time understanding that it's taking away because we're still collecting data. We're still saying that the individual had the opportunity. So you have an option in Therap, but it's one or the other. You don't have like a middle ground. You either have your absent, refused, or not applicable show up on your reports, or if you mark them as non-reportable here, that means they will not show up on your reports, meaning they won't factor into the monthly reports that you can run, and they won't factor into your totals. So you have to determine what you're really looking for in pulling that data, that information in the big picture. If you're really looking for your calculations, your percentages of completion, of whether they engaged or not, then it may be that you decide to mark these other ones as non-reportable. But what that means is, again, if you look at the programmatic report, you won't see NA, refused, or absent on your programmatic report with your percentages. The only ISP data report that you can run that will show all of your scores based on how the staff collected data is the clinician report. So even if you choose to leave these as non-reportable so that they don't deflect from these two calculations, you can run a clinician report. It just means you'll have to get into the practice of running two reports, one to get your percentages and one to verify that staff still collected data. Now, I'm going to open this up for questions. I know that it might be a little bit easier for you to kind of wrap your mind around when we look at the reports themselves, but I just want to see if at this point, if anyone has questions, comments about how you're using them now, or anything that needs to be clarified. So please chime in if you need any clarification around this. Okay. I see one question come through the chat. That's a really good point. Thank you, Donna, for speaking up as to how you're using it currently. So Donna indicated that they used refused in reportable because the individual had the opportunity to engage but refused. Donna, are you also using not applicable and absent by any chance? I also like to think about that just when thinking about real life application. The plus is accomplished task. The minus is did not accomplish task. But if I were a DSP and I were documenting, I would kind of think that even if someone didn't accomplish a task, maybe that meant that they still engaged in it. But the refused is a little bit more clear, saying that they had the opportunity, but they refused to engage. Okay, so Donna answered my question. Some may use not applicable or absent, but not as a reportable factor. So thank you, that really helps. And I have had a lot of questions from providers about that. So I think it's good to glean from those experienced providers that have been using ISP programs in real life application in South Carolina. Okay, so this is a one that I am seeing quite often, this set of scoring methods. I also can take a screenshot of this, and if you want me to email this to you, if you want to replicate it from your admin tab so that it's in all of your ISP programs as an option, just let me know, and I'm happy to share things with people. Okay. So that's the one I chose for this specific ISP program. That's going to be the options that the staff will have on the data collection page. Next are the details of the ISP program. This is really setting the perimeters for the staff's collecting data. The type of service provider, I'm getting ahead of myself, just one moment. This other details section, it's another piece that I recommend the admin team consider. And you may want to take an ISP program that you've created, whether it's you or one of your CTH coordinators or one of your supervisors. Look at the other details section and look at the scoring methods. Just look at all of the details in the ISP program. And if you have a really solid ISP program, you have the ability to export it to PDF when it's approved. This is something that I would recommend you reference a strongly written or one that you're all comfortable with, maybe a cross-residential program or a cross-your-day program. Use it as your own internal template of sorts to reference so that you can set up your other ISP programs in a similar fashion, if not the same fashion. Because the perimeters that you set, again, on this page, it determines how the staff collect data. And it can determine how you're able to reflect on your measurable outcomes and track trends, how you're able to track the person's progress or regression on a goal, all of that in the big picture. It will factor into all of that. And some of these fields are not editable once you approve the ISP program. You always have the option to discontinue an ISP program and copy it over and then tweak it and then approve it again as a new one. And that is a fairly seamless task, but you want to take into consideration your date of the month and things like that so that the staff still have ISP programs to report on. So I definitely recommend that you take these fields into consideration, and I'll explain them to you. But if you have any clarifying questions, you can either ask during this training, and I'm always happy to answer through an email as well. Okay, so back into this. The type of service provider, so that may be the staff that are providing the support. Is it CTH1 staff, CTH2? Is it a residential instructor, a day hab staff, day program staff, whatever their job title is, you can indicate here. You also can leave that blank. It's not a required field. You can use any of those there. Okay, I'm just going to clear that out. Entered by and program author will default to my name because I'm logged in. If someone else wrote this goal and objective that's already in place, you certainly can change and reflect that someone else wrote the set of goals. That's really up to you if you feel that that's necessary. Now, time duration. If you want your staff to indicate when they worked with this individual on this shampooing goal, you can indicate begin time, end time, or duration in minutes, or none. It's entirely up to you if those fields are required. If you choose one of these fields, you can then indicate if it's required for data collection. I'm going to go with yes, just so I can show you. Are comments required for data collection? Now, the comments are a big comments box. I prefer to use this one down here, scoring comments, and this will be to the right of each task. We haven't written our tasks yet, but we're getting there. So scoring comments will be to the right of each task. And if you break down a task analysis, so it's healthy eating, or if it's shampooing the hair, or money management, or counting change, counting coins. If you have multiple tasks, it may be that you want your staff to provide some type of narrative for each one, or for those that they supported the individual on. In that case, you would use scoring comments if you want some narrative for each one. Back up to comments. I don't like the large comments box. I just think that it can be redundant if I'm using scoring comments, so I set that to no. Again, I'm just explaining each field to you. I'm not giving you guidelines. DDSN did not provide guidelines. It is a matter of judgment and what you want as best practice at your agency or board. Is location required for data collection? So if the individual is supported in multiple different locations, it may be that you want to see that and see which businesses in the community they're visiting, or if you want to see if they're visiting different peers in the community, or going to specific locations that might be advantageous based on the goal that you're working on. Editable service provider. So what this means is, do you want the staff to be able to indicate that they're documenting in Therap, but that someone else provided the service? In most cases, the staff that provide the service are also required to document, but we do recognize that some providers do things differently, and they may need to make exceptions for certain staff. So you determine whether or not that's allowed. I skipped over this one right here. I apologize for skipping around. Default score, I highly recommend you always leave that at select score. You really wouldn't want to choose something, because then you run the risk of the staff not making a selection, and then you won't be getting accurate data from the staff. So I recommend you always leave it at that. Billable ISP program. So you can bill in Therap if and only if you're using electronic billing in Therap. That's the only way that this ISP data feeds into your billing. You could use ISP data and run reports and give those reports to your billing department. But if you are planning on eventually using billing in Therap, which is a discussion item with DDSN, it's not part of the contract with DDSN. So if the provider ever wants to purchase electronic billing, the big picture is you can set your ISP programs up as billable. There's no harm in saying that it's a billable service, even if you're not using electronic billing in Therap, because it's just going to say that it's a billable service, that this goal and objective the individual is working on is part of their plan. Okay, the last two fields. Allow collection of a multiple task score for single day. So I've worked with some day program supervisors who are using ISP programs in South Carolina, and there may be an AM goal and a PM goal, and you can track them on the same ISP program. You can write two tasks. You can write an AM task and a PM task. If you don't want more than one staff reporting on each task on a given day, then you can say allow collection of multiple task scores for a single day. No. And what that means is if the AM staff go in and they report on the AM task, the one that's labeled as such, and then the PM staff go in, they'll be able to just report on the PM task and leave the AM task blank. So that it's respective of their shift. And also what it does is if someone goes in to record on AM and it's already been recorded, it will give that staff person an error message and tell them that it's already been recorded. So that's a way to ensure that you have accuracy across the collection of tasks across shifts. Does that make sense? Okay. Allow data collection with time overlap. So it's similar to the one above, but really this factors in if you're using begin time, end time. So if First shift staff indicated that they assisted Sarah with washing her hair at 7 a.m. and they worked on this goal from maybe 6:50 a.m. until 7:15 a.m. or something like that. What this will say, if you check off no, then it means that no other staff can come in and report on the same goal itself, the whole entire goal, within that same time frame. It will give the staff an error message if they attempt to. Okay. So there's a lot of details here, and again, I just go over them with you. I do give you some slight recommendations, but it is up to your administrative team to determine what's best for your group. And I do recommend you kind of go with a set standard and share that with your group so that you have consistency. Does anyone have any questions so far? Okay. The next thing we're going to get into is the actual tasks. So this is what the staff will be reporting on, what they'll see on a daily basis or every other day, however often they're expected to document. This is what they're working with the individual on. It's the objectives, and also referred to as action steps. We call them tasks. The task name, I think there's a limit of 12 characters here. It's really a way to label your tasks so that they show up in the reports and you know what's being worked on. So for shampooing hair, one of the first things would be for Sarah to get her hair wet. And then maybe there's another task with her measuring out a quarter size shampoo. I'm assuming Sarah has long hair. That's just where I'm going. So it might be a task for measuring out the appropriate amount of shampoo into the palm of her hair. That might be the second one. So this one I'm going to label wet hair so that I know on the report exactly which task she's working on. I like to phrase things person-centered, but please, again, use the terminology that's coming directly from your goals. You also can give staff some guidance. Some of you use teaching methods on your goals and objectives, and we do have a place for teaching methods on the ISP program, but those don't show up on the daily data collection for the staff. So I like to say this could be a good place for you to include those. If Sarah needs verbal prompts, or if she needs some partial physical assistance or hand over hand, that might be a good place to reference that so that the staff are really seeing that reminder when they collect data. For your baseline scores, this is not required. I have worked at the agency, or excuse me, an agency where we indicated the baseline scores because we already had those for an individual. But certainly you can use Therap's ISP programs to calculate the baseline scores. So you can look at a window of time, maybe 3 months or more, when your staff are using ISP data for reporting. And it can give you your baseline so that it's really accurate. That's what I'm seeing most providers do, is just leaving this blank to start out with. Now, if I have another task, I'm going to click on Save and Add Another Task. If there's only one that the staff are reporting on, I would click on Continue. Okay, so I'm just going to leave that measure. I'm running out of characters. And then I'm going to go with one more task. Again, I'm being a little bit detailed here by adding a teaching method to the staff, or for the staff, but that's just me. I like to see things a little detailed. Okay, so I'm going to go with those 3 tasks for the shampooing of her hair. This might look a lot different than the ones you were thinking of, Donna, but I do like to kind of go with things. My mind starts to work as soon as I hear of a goal. And if I'm happy with those tasks, I'm going to move forward. If I have to edit any of those tasks, I can go to the bottom and click on edit. So if I have my order off, or if I want to add a numeric character so that there's 1, 2, and 3, I can do so. Again, if there's a repeat, I can remove a task. That just gives me the opportunity to edit. So at this point, I'm pretty much done with this ISP program. I'd like to open it up for questions before we move forward. Okay, so there's a few fields that I can reference here. You have the ability to attach files to your ISP programs, and you also can add images if necessary. The teaching method, as I mentioned, that it can be a really nice feature. It can really just assist with that person-centered process of ensuring that the staff understand how to support an individual. But the teaching method does not show up on the daily data collection page. And that's why I added some of the teaching methods right into the task itself, just to be really detailed. That's why I do that. Okay, you can have multiple teaching methods if necessary. All right, well, before I approve, does anyone have any questions? Okay. The action buttons on the bottom of the ISP program are based on my super role assignments, so I have the ability to approve my own ISP program. Now, for those of you that are writing ISP programs, please make sure you save, especially if you're getting up away from your computer, or if you're taking a phone call, anything like that where you're not actively working on your page. You all should have a session timeout set to 15 minutes in your provider preferences. That is an expectation from DDSN for security. What that means is if you step away from your computer and you haven't saved, and you're gone and you're inactive from the computer, from Therap, from 15 minutes or more, you run the risk of losing your data, and we can't retrieve that for you, unfortunately. There's no autosave in Therap, and we can't add that in as an EHR. We have certain standards we have to meet for staff to intentionally take action within the system. So please be aware of that at all times, especially when you're writing something really detailed like this. If you save it, it goes to your to-do list. So I'll show you that quickly. It would be on my to-do tab. I have a lot here in this demo account. And it would be under ISP program work list. I'm just going to reload my screen here until my work list shows up. It sometimes takes a minute or two to show up on the there we go, on the to-do list. So ISP program work list, that's something that's either saved or sent back to me. So this is the one I saved. It's in prep, and I can make my edits. You do have T notes here too. This is another little thing that you could do if you want to leave yourself a note. That's something you certainly can do if you're going to come back to this later in the day or on another day to finish up. I like that. I think of those as electronic sticky notes. And when the ISP program gets approved, those will clear off. Now, for those of you, if you have it set up in your account that some of your staff, such as CTH2 coordinators, I'm going to use them as an example again, or CTH1, I forgot their title. I think it's CTH1 staff or direct care. So any of those staff that are writing ISP programs, if you have it set up so that they can write, but you or a supervisor approves, what they would do is they would submit when they're done with the ISP program and move it forward to the person who has the approved super role. And again, it would show up on the to-do list for the person with the approved roles. I also have those, and of course, you saw that. So now I have my approved count is increased to 3. So here's the one that I was working on for shampooing hair. If I wanted to send it back to the author, I could also use the T-note for that. And I could tell her what she needs to work on. Okay, and I could go to the bottom and click on Return to Submitter, and it will go back to Leah as the author. And it will show back up on my ISP program work list. So we can have those messages go back and forth. And then when I'm ready, if I'm the approver, I go ahead and approve, and it will tell me that all the T-notes will be deleted upon approval. So it really cleans up the document. Now, I also mentioned to you that if you have a really nicely written ISP program and you want to share that, you can obviously share it within Therap. You can send it to people through SCOM. They will be able to read things in SCOM about an individual if they have that individual in their caseload. The alternative is if you want to print it out and maybe you have a folder of good examples for goals and objectives in Therap, something like that, you can use the PDF version as well. So just keep that in mind. Display printable just means printable within Therap. It's not PDF formatted, but that's okay too. Okay, so I'm fine with the T-notes being deleted. So it's going to tell me when it's approved, and then I do have a quick link to enter data, but I like to show people the long way around. So once an ISP program is approved, the author and all of the staff that work with that individual will now be prompted on their to-do list to acknowledge it. So this is a way to get an electronic signature of the staff signing off on that ISP program and saying, I recognize that this is in place. I agree to implement this with the individual. So the staff can certainly check that on their to-do list. If they don't do that, when they go to ISP Data New, they'll be prompted there as well to acknowledge if they haven't done it from this page. So either or, I'll show you that. Before we get into that, I made a mental note. On the admin tab, for those of you that have admin access, that's where under the care section, you can set up the ISP program scoring methods for your agency or board. We have a list here, which is, again, because we're in a demo account, there's 72 in here. So you can see your list. You can also go ahead and write a new one. So that's something that you can consider doing. Again, if you want to use plus and minus, you also could label it something like, day programs or residential if you have a consistent set of scores that you want in the ISP programs across those programs, those services. And it's the same. The fields are the same as what I went over with you previously. It's just that it will now show up on your default list. Okay. So before we get into ISP data collection, does anyone have any questions about what we've gone over so far? And if you're hesitant to ask out loud, you can also ask through the chat panel. If you're asking a question now and I'm not responding, it might be that you are muted. So just keep that in mind. I'm happy to have you ask through audio, but you'd have to unmute yourself first. and you do so on the Go to Training panel directly under the orange arrow. Also, if at any point the orange arrow or the Go to Training panel is in the way, you can click on the orange arrow to minimize the Go to Training panel. Okay, well, if there are no questions, we'll get right into ISP data collection, which is typically done by staff working in day or residential programs, perhaps your CTH1 caregivers if they're set up with internet access there. Again, please keep in mind that DDSN does want CTH1 programs using Therap, so just follow up with me if you have any questions or you need any support, regardless of where you're working from. But I do want to make sure you're aware of that. Okay, individual. ISP data new is where those staff would go to report on the goal and objective. Okay, so I would choose my program. For those staff that only work at 1 or 2 programs, they would only see those from the list, with the exception of if the individuals have moved around a lot, because they'll be able to see documentation coming from previous programs. Okay, so Sarah Active, and as I mentioned, I have a lot in here for Sarah. There are also a lot of creative ways you can use ISP programs. We're just covering goals and objectives for now so that we can assist you in meeting that timeline of using them for data collection effective September 1st. But there are certainly different ways you can use ISP programs. There's behavior tracking, psychotropic med tracking, more behavior-related ABC data collection. I've worked with a provider in Massachusetts who used ISP programs for their residential logs. And I was at a conference last month, and part of the 7 rights of an individual? So that was something that was being tracked within that state. So that's another creative way of using ISP programs is, making sure that the individual is aware of their rights. But we're just going to go with the one that we created together, which is shampooing hair. As I mentioned, before I can collect data, I have to acknowledge this and agree to implement it. And this will put my electronic signature on the ISP program. And then admin staff will be able to run a report and see all of those staff that have signed off on the ISP program. So I get a message saying, I acknowledge I have read, understood, and will accurately implement this program. And this interface has changed a little bit. So if any of you have been using ISP data, there was an update to this in July. I'm sure you've noticed that already. The formatting hasn't changed. It's really just some of the fonts and a little bit of the style. Okay, so we see a link to the full ISP program. If I just read it and acknowledged it, but if I needed to access that full page in the future, I can do so right from here. I mentioned before that there is the ability to do late entries in Therap, so I can indicate I provided the service maybe on Monday and I forgot to complete data. It will date and timestamp when I submitted it. So all late entries are transparent. There's no way to fib about a late entry in Therap. I am going to do that just so I can submit 2 bits of data and show you on reports. So based on how I set up the ISP program, we see the formatting is evident here. I indicated begin time, end time was required. So if I worked with this individual in the morning before day program, I could indicate that. Again, you don't have to have this required. You can use time duration or you can use none. And if the staff forget any of these fields, the system will prompt them. So I'll leave a few things blank. Okay, for the task scores, this is based on how I set it up. I set it up that multiple scores for the same task cannot be entered in a single day. Again, I was just wanting to show that as an option because some providers in South Carolina are using one ISP program for an AM and a PM goal when it's the same objective. but they'll label it as AM and then label one as PM. So I could go in here and see the task, and I also see a little bit of guidance here on the left. So Sarah will wet her hair in the shower. She will ensure her hair is saturated and not dry. And then I indicate whether or not this was accomplished. Now, I mentioned to you that I like to use scoring comments. As you are aware, I tend to get a little bit narrative and wordy with my documentation. So this allows for the staff to document more than just a plus or a minus. It might not be super applicable with shampooing of hair, but it could be applicable to something that's more detailed, such as healthy living or even counting money. Maybe we need to know what type of coin the individual was able to identify. That might be an appropriate way to use this field. Okay, I also can document any progress or regression. That might be another way to use this. Okay. And this comments box down below, I did not indicate that as required, so I can leave that blank. And as I mentioned, I just check off billable, yes, in my ISP programs just out of habit. And again, if it's a billable service, I see no harm in saying it's billable, even if you're not using electronic billing in Therap. Now, if I go to click on Save, which actually means Submit, it's going to give me an error message because I didn't choose AM or PM. So this is a way that Therap has those checks and balances in place to ensure that staff are submitting complete documentation. Does anyone have any questions about the data collection? Okay. We have these quick links. I could enter more data for this ISP program, so this might be helpful. I just submitted data for the 15th. Maybe, again, if she had washed her hair this morning, I'm just going to quickly do this so that it shows up on my report that I'll go over with you in a few minutes. I did not mark the scoring comments as required, so I also have the option to leave those blank. This link is enter data on another ISP program for this individual. You all saw the amount of goals and objectives I have in place for Sarah. So if the person supporting her needs to track on something else, another goal, they can go in and do so. So I'm going to go with exercise. I like that one. So if she also engaged in exercise on the shift, I can document that. And it's marked as not applicable. And this is, again, I caution people on having a scoring method default to something, because if the staff left this alone, if they didn't remember to change it, it just could lead to inaccurate documentation. So this is an example of a different type of scoring method that I've used previously, and this one is more based on other state standards of having the level of supervision that the staff had provided. Okay, so I'm just going to say that's not applicable, and she rode her bike at home. Okay, so those links can be handy. The next thing I'd like to go over with you is running reports. On the individual tab still, to the right of ISP data, we would look at report. And these reports are great. They can be used, again, for tracking progression or regression on a goal. They also can be used to replace monthly summary notes or progress notes because there is a narrative piece on each report. But you have options in your reports. So when I choose Sarah, I will see all of her approved ISP programs. At the top of this page for the ISP program list, I can filter by all, approved or discontinued. So if I want to run a report on one that's been discontinued, I still can do so. And that will allow for me to see the data the staff have collected or the progress that she had made in relation to that goal. It defaults to approved, just so you're aware. So I can run a report on one ISP program or bring in multiple. So if I want to see what the staff have documented on shampooing and exercise, I can go ahead and choose both, and it will separate out the goals if I indicate for it to do so. The programmatic report, this is the most common report that providers use. Again, I'm also hearing from providers in South Carolina that they're using this to calculate their percentages. And that's where there has been some question about if you mark a scoring method as non-reportable, it won't show up on this report. Clinician reports will show you all of the data, even if it's marked as non-reportable, but it's more of a narrative. It doesn't have percentages. So if you want to get both, if you want to see absent, but you don't want it to show up on your percentages, you can still see it in a clinician report. Okay, programmatic is the one we're going to go with first. You choose your date range. So you can certainly go by 1 month at a time or go back a little further. So I'm going to go back to July 1st. Actually, I might go to the middle of July just to keep it to 1 month. And my review period, I can hone in on the columns basically can be by day, week, month, quarter, etc. So you can go back a year or more when looking at this report and then really get into aggregating that information. So I'm going to go by week simply because I chose a 1 month period. Linked ISP programs. What that means is if I had a shampooing program or an exercise program in place before that was discontinued, if I include linked ISP programs, it will also show me those DC'd ones, the data from that. I can get into deviation from baseline score and from previous score. I'm going to unselect those just because I don't think they're necessary here because I don't have her baseline indicated yet. I can see percentages only or trial count or both. So the trial count is going to give me a number of how much data was submitted for each date. And if I go with both, it'll give me both of those. Add progress and comment per ISP program. So I included 2 ISP programs. If I'm looking to gauge and use this as a monthly note, then I'm going to separate the 2 so that I can indicate the progress from a drop-down, which I'll show you. I should have asked, are there any questions about how you configure that report? We can go back to that page if we need to review it together. Okay, and please just chime in if you have any questions at all, even if it's about something we already covered. If you want to save a report, you need to title it. In the titles, it will include the individual's name and the date range. So I'm just being a little redundant here, but that's okay. So for here, we see the shampooing of hair goal, and it gives me all the details. It gives me the scoring method, including the labels. This is, again, why labels are important. The tasks with the labels. And then the grid will display, and it's configured by week for 1 month. So I have the first week that I chose in July, mid-July, 17th through the 23rd, and then the 24th through the 30th, etc. I just created this goal. I said it was in place since June 6th, but I haven't done any late entries other than the ones that we did together. So down for this week, that's where I have data for the shampooing. So here again, it labels it out by those 3 tasks, and I see the options that are reportable. So those scores are the reportable scores, plus, minus, or refused. So I get to see the score itself for that date, that week, the number of data that was collected, so 2 for that week, and then the score for those counts. So I see for both of those counts, it was 100% completed the task of wetting her hair. Then for this one, for measuring the shampoo, 100% for those two counts of data for that week for that task, etc. And then the total will total it up for the whole entire report. So throughout the whole 30 to 31 days that I had selected. So I see over that course of time, there's only 6 bits of data collected, but 100% of the time, she engaged, she accomplished that task. Okay. For progress, this is how I can really indicate, measuring the outcome. I can say that she is making progress, and then I can elaborate. This is basically the space that could be used as a progress note or monthly summary note, and it will expand as I type. Okay, and next we have the exercise goal. Remember that I chose to include 2. I don't have to. I can do 1 report per goal, but I just wanted to show you the variances here. And of course, I wrote this exercise goal quite a while ago, and I used a different type of scoring method. And the only one that's not non-reportable is not applicable. Okay. And then I have my tasks. So she had the opportunity to go to the gym, she engaged in cardio, or she used the bike at home. The reason why I went with this one is because I remembered I collected data last month at a conference. So I have some data from this last week in July, and I see, here we go, verbal prompt. There's 1 count, 100% of the time she engaged in this task with verbal prompts. And then same thing here. And then it'll give me my totals. So I see my totals for the month. There's only 2 bits of data collected. So it's a good thing to have those counts because you can see how often the staff actually report on something. And then I'll have my total. Oh, this is the week this week now. Okay. I like this piece of totals too, because if there's different scoring methods being selected across the date range, this is a good example of how it really gives you the exact percentages. So I see that she completed the task, and that means completed with staff supervision. It's my alternative to independent, because where I come from, we don't use the word independent because that could mean recoupment of money. So I learned when I was in the field to not use that word. Completed with staff supervision, 33.33% of the time based on the amount of data that was collected that month. Verbal prompts, 66.67% of the time based on the data that was collected. So you really get an accurate picture of your percentages. But as Donna and I indicated, you have to really keep in mind what you want showing up, excuse me, here with your scores as reportable or non-reportable. Now, if you indicated that absent was non-reportable or not applicable, this shift was non-reportable, but you still want to see if your staff collected data, you will have to run the clinician report or do an ISP data search. You can't really have it both ways. You can't have it non-reportable and show up on this report where your percentages are labeled. So please keep that in mind. You can save your reports. If you're using them for a summary note, please make sure you save it. And where it goes to here, ISP data, search report. So report is when you want to run a new one. Search report is when you want to look for a saved one. So I like to just look by my own name, entered by, because in most cases in practical use, I'm looking for the ones that I've written. If I'm reviewing ones written by people that I supervise, then certainly I could just look by the individual or look by the program. I think that I also can leave all these fields blank and just look by a date range. So that might be a more efficient way to look for reports if you're having to review them. Yeah. Okay, so that's how I can pull that back up. I'm going to go back and look at one written by my coworker just to peek on what they're doing. I'm going to look at Shay's. Shay writes some really great stuff. So this is a clinician report that Shay had written. It looks a little different. I will show you how to run a clinician report. But let's say I have to document on Shay's notes that she's written. She's thinking the same thing that I am. I could go in and write a comment and say that I reviewed Shay's report. Or as a supervisor, I reviewed this, whatever I need to write. I don't even know who I'm writing about. This is about Sarah Sojourner. Okay, and then I could save my comments and it will show up on that report at the bottom, indicating that I reviewed the report that Shay had written. And it will display my title, so if I am her supervisor, it will, indicate that. If we have any recommendations as far as treatment changes, that could be indicated there. So that's how you can use the reports. Let's get into the clinician report just again to show you the variances between the two. So again, when I run a new report, I'm going to ISP data report. And I'm going to go to 6th Street for my individual, Sarah. I'm going to stay with those two programs that I have in place. I'm going to choose clinician this time, and I have fewer options to configure this report. It's more straightforward. You have 2 other reports to choose from, but we'll see how much time we have. So this one is going to show me the comments that have been written. Some people like this report also because it totals up your duration if you're using that field. And also the other thing about this report is if there's multiple bits of data submitted for the same date, it will display all of them. Okay. So here it has my scoring comments from back in July. I didn't write anything today for scoring comments, so that might not be a good thing. But this will also display any not applicable scores. So right here, I chose 2 not applicable. It will still show up. So again, if you're tracking absentees, I hadn't chose any absence on mine, but it will display that. This one can be exported to PDF in Excel, just like the other, but it also has the service verification form option. This is used most commonly for self-advocates, and perhaps if services are provided in a family home and a signature needs to be obtained, that's what other providers are using this for. There are a good number of self-advocates in the system. Okay, so I have a question here. Okay, thank you for participating. I always appreciate that. Okay, any other questions at this point from the group? I know we're almost out of time. I told you I'd have you for about an hour and a half. There is another report. I would recommend you check that out. It's the monthly summary, which can be really helpful. I'm just going to show you quickly. You can stick around if you have time. The data collection monthly, it will actually bring up a grid and it will show you where staff have collected data. If there's multiple data for each date, it'll just show the most recently submitted one, I think, or it could be the first one of the day. I'd have to look into that. Trial and error would help me out there. Okay, and you can click on that blue link and it will take you directly to the data collection. Okay, another question. Is it better to use the reports to monitor without the bar or line graph? That's a good question, Stacy. I skimmed over the bar and line graph. It's really a matter of preference. Most providers in South Carolina are looking for percentages because you're really used to seeing that, and you're also used to having to calculate that by hand, which is a time saver. If you're just using programmatic and you're using percentages, that's what I'm seeing most people do. But you absolutely can use bar or line if you want to. It's just an option. Any other questions about the reports? I had one more point about this one. This one also, again, it's called Data Collection Monthly. If you want to save it, you have to title it, but it will display the signature log of any of the staff that have collected data on those goals. And it also allows for 10,000 characters in this narrative box. This signature is actually my electronic signature, meaning we don't have a signature pad in Therap, but it means that if I save it, it'll put my name and job title on this line. Okay, so I'm going to save. I didn't write anything. I should have. I need to write a narrative. I apologize. I would have to write a narrative in order for it to put my signature on there. So bear with me. And I can't duplicate the name. So I'm going to call it August version 2. And again, I'm just giving you options. That these are not required for you to use the reports for monthly summaries. It's not required by DDSN. They just really want you to replicate things in Therap because the system is available to you. It is obviously mandated. So the big picture from DDSN's perspective is if you're doing it on paper now, and some of the things that you do in CDSS now need to be done in Therap, effective those dates listed on the timeline. So that's really the big picture. There are some areas where guidance has been given by DDSN, such as your programs, your password policy, your sign-up agreement, your provider preferences. So we've gone over all of that in the last year and a half. The case manager piece, if you have case management accounts, there's guidance from DDSN. So if you have any questions, go to this table on the South Carolina page from Therap's homepage and check that out. We do have newsletters also. The timeline was shared with folks at the May conference in Columbia, and it was also shared with folks in our April-May newsletter and on this page since then. But I have recently put out an all admin eye contact, meaning a group email that goes out weekly, and it has all of these dates on here. And I'm sure a lot of you saw that, and that's how you got to this training. Any idea, Stacy asks, any idea on the timeline for ISP plan implementation? That's coming. I don't have an exact date. We're still finishing the ISP plan. It's a weekly thing that's being worked on. But most likely you'll see more communication on that in the coming months. I would guess to say, or I would say that you should plan on seeing more of that before the end of the year about ISP plan. Again, that doesn't mean that that's when you're going to implement it. You're just going to get more word on that. It could be implemented before the end of the year. We're really firming things up with DDSN right now. But we'll have a lot of training. We have a very robust training schedule for writing the ISP plan this fall. So you will be presented with training opportunities this fall, meaning like October and November. You're welcome. That's a really good question. It's probably something that I should work on getting out there to the rest of the providers. And I'll make sure I follow up. It's been a big topic of conversation this week, so you'll hear from one of us on the team. You'll see an email go out, and we'll be giving you more information and links so that you can sign up for training opportunities. Okay. Does anyone have any other questions about ISP programs for goals and objectives, collecting data on a daily basis, or running reports? I will post this recording, and as you know, I'm holding more throughout the month, but please reach out to me through email. I will share with you my email address in the chat. It's also on the South Carolina page, and when you reply to the go to training, when you registered, I get the email. So you probably have my email just about everywhere. In case you don't, I just sent it all to you through chat. Please reach out with any questions. This is most of what I do is hold trainings online and meet with people online. I will also be at the SC or South Carolina AAIDD conference in October, but I hope to hear from you before then, because I know that there's a sense of urgency in getting all your ISP programs up and running. You should have them all approved before September 1st so that you can have your staff collect data effective September 1st. So let me know if you have any questions at all. Thanks, everyone.